headline that rather scares me is about WASH in institutions. So if you look at the full complement of having water, sanitation, and hygiene in healthcare facilities, the number in this country from the 2021, the cholera, for example, is worse. There's more breeding, there's more. Oh, we need to do it on my computer? Just a moment. The PowerPoint is here. They can connect it. Sorry about that, guys. Around WASH, and this is from the most recent norm. I think we're blessed in this country to WASH data because it makes all the difference for the country to be. That's what I mentioned here about the school data. 11% for schools, 6% for healthcare facilities. Really rather worrying statistics. Next slide, please. Another area that the norm covered, which I didn't mention earlier, is urban utilities. And the slightly shocking fact that of the urban utilities that we do have, we're only working at approximately 25% of the potential capacity that exists. But there's still a lot of states that have non-functioning or only partially functioning utilities. And so urban water is a huge issue, and particularly also the quality of the water. You can see here that for the sector. And then, of course, financing, as has been mentioned by several people. There just isn't enough investment for what we need to achieve if we are going to achieve the SDGs. And finally, obviously, the insecurity is an issue, but I'm not going to talk to that one because I think you all know more about Nigerian insecurity than I do. But just to say that it is a clear challenge to the sector, as to many sectors. Next slide, please. In terms of the climate risk, in fact, Nigeria is one of the worst hit in the world. And a recent study by UNICEF found that Nigeria was second only in the world with the highest climate risk index for children. So on this kind of composite score of up to 10 items, Nigeria scored 8.5, which is really very scary. And it means there are multiple deprivations all compounding to make the risk for children one of the highest in this part of the world. Next slide, please. I think you missed one. Yeah, and as I mentioned as well, the temperature, the rainfall, the flooding, all of these issues are compounding to make the work in WASH even harder. And often, you know, infrastructure is swept away in a flood. We have to start all over again. So that's why behavior change is so important, because if you have the habit, you'll rebuild your toilet. But that's a digression. Next slide, please. Whoa. Erratic rainfall, here we come. So in terms of the environmental hazards as well, I think there's a huge risk, and this is a picture not a million miles away from where we're sitting right now, of some of the plastic waste that is choking our waterways, is choking our drainage channels, so that when we do have these massive rainfalls, it can't drain away, which is why we get flooding, because it's full of plastic rubbish. I think we need to really concentrate on the solid waste piece. I know it's not strictly WASH, but it's definitely linked very closely in terms of being able to have a safer environment, and also more drainage back into the ground, replenishing those water resources. Next slide, please. So this, as I mentioned, is just a schematic of how poor the sector is compared to what is actually needed. It's estimated that we need as much as 10 billion annually in this country to achieve the goals of the WASH sector. But what we're actually getting is a little less than 1 billion. So you can see the huge gap there. If we're really going to achieve these, we need to talk about investing, and it's not only long-term investment, but it's local investment. And are we making sure that the investments in the sustainability piece, the spare chain continuity, the training of mechanic and quality? Next slide, please. So some of the areas that we've been working on, and I think IHS in their address alluded to some of this work, looking at facility management models to really, when there is an infrastructure, supporting a community to develop whatever model works for them, be it privately led, so we're paying someone to manage our water for us, or community-led, voluntary-led, and we all just chip in when we need a spare part. But there are definitely different options for managing systems, but there has to be a broader state-level element to that, where mechanics are trained and they are paid to maintain facilities, and that there is a supply chain of spare parts for pumps, so that things are operated and maintained rather than break down and then fixed when they're really broken. So it's much better to have routine maintenance, just like your car, to make sure that it doesn't break down, blow up. Some of the water points. Next slide, please. So this is a slide I happily had to update last night because 2 more LGAs were just declared open defecation free yesterday. Yeah, one of them was, I believe, the president's LGA in Katsina, yeah? So it was great news. So we now have 102 LGAs that are open defecation free in the country, and 1 whole state, which is a fantastic achievement, and that ball. And I see Mrs. Opara is sitting here, she's laughing. The chairman of the Clean Nigeria campaign, ladies and gentlemen, because we know that despite all of the efforts that we've been making, the snowballing is really not snowballing as much as we'd hoped, but we is one of them. FCT is another, to become open defecation free in the next year or 2, but we need more. I feel like all of these LGAs, it's like little isolated islands around the country, building a toilet anymore. And these things are working. Next slide, please. I just want to show you some of the numbers that since we've been doing this work since about 2016 with toilet business owners, we now have almost 500 of these small businesses in the particular states where UNICEF has been working that are really providing toilet services, and they are going from strength to strength. They now have local business associations. They pull, and you can wash your hands, have a shower, and then there's all sorts of peripheral businesses that develop on the side. So it's a real meeting place, congregation place. These are now happening in FCT. They're happening in the Northwest, all over, not all over the country, but in several parts of the country. These PPPs in public places, completely privately owned, very sustainable business, are happening. Next slide, please. So UNICEF has worked to develop various different materials for market-based sanitation. So it's really easy to move forward with some of these things. And one of our big partners is Lixil, who developed the blue plastic Satopan that I'm sure many of you have seen. And that this is a really strong tool for conversion of a hole-in-the-ground toilet to a really smart, improved latrine. And many of these resources, I'm not going to read them all out, but they are available for supporting this process. Next slide, please.